Welcome to the Specialty Pharmacy Podcast. This Specialty Pharmacy Podcast is a collaboration with the National Association of Specialty Pharmacy, the NASP, and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists, while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the Specialty Pharmacy Podcast in partnership with the NASP.
Welcome to another episode of the Specialty Pharmacy Podcast Show, part of the leading Pharmacy Podcast Network. I am your host, Christopher Kennedy. Today we have a guest from one of the top 10 pharmacy benefits management companies in the country. Please welcome Tom Golding from MedTrakRx. Tom, great to have you on the show. I think we will kick off here, if you will allow us, with a quick intro about who is Tom Golding and where have you been previous to your time here at MedTrakRx.
Yeah, Christopher, thanks for your introduction. Excited to be here speaking with you today. A little background on myself. I'm the Vice President of Trade Relations for MedTrakRx. We are a pharmacy benefit management company located in Overland Park, Kansas. It's always interesting to try and answer that question in a social setting to your friends. What does a PBM do? And I think probably most of the audience understands that, but never thought I'd be with a PBM based on my early background. It started out in the pharmacy world, believe it or not, when I was about 12 years old, as my family owned a small Rexall drugstore in a small rural farming community in mid-Missouri. Granted, my responsibilities certainly weren't in the medication side of that world, but my responsibilities around washing windows and vacuuming and cash register duties, but did grow to where I was able to work back in that pharmacy area with my dad, and that's probably where I got my understanding of what a pharmacy does, a pharmacist is supposed to do, and ironically, kind of back in this position. I also spent about 15 years after college working in the sales position for Cardinal Health, which is top 1, top 2 pharmacy wholesale distributions, and learned more in that side of the business from a pick, pack, and shipping standpoint in the pharmacy and med-surg world. And then, like I stated before, somehow found myself back in the drug management related industry with MedTrak, and I've been here for about 3 years now. And primary responsibility is managing the retail, mail, and specialty pharmacy provider network. Also, which I really enjoy, is the relationship aspect of that, as well as developing and exploring new programs and processes that can help impact our client base and drive some opportunities and savings and increase the service level experience with them for our specialty pharmacies and retail networks.
Well, it's really interesting to learn that you spent your early days in that pharmacy setting, more in that rural environment. I feel like there's almost a longing for that type of customer service nowadays that seems to be lost as we wait in these long lines at a lot of the different mass pharmacies, et cetera. So I'm sure that has had an influence on how you deal with customers as well.
It is. It extends beyond our member base. It's interesting that rarely do we have an issue at the member level with any of our pharmacies, but when we do, and it's impactful, I'm one of the first to actually jump on the call and actually reach out to that member and understand what their experience was. And what that does is it does probably reach back to my days with being in that environment and understanding how my dad worked with those individuals, because he wasn't just picking a claim, filling a prescription and sending somebody on their way. He was the first one to ask, do you know how to take this medication? And usually the response was, whether it was yes or no, he still went into the process of saying, okay, this is how you take it. Be sure to do this. I'll follow up with you. As well as I remember vividly several conversations he had with some physicians that would prescribe a particular medication, and he would basically have a stern conversation with them. It's like, you understand, you just prescribed them X, Y, or Z, and this is going to not, this isn't a compatible drug, and that they're going to have some conflicts going on. So I think I've taken that subconsciously and applied that not only to what our goals are as a PBM with our members, but I've also taken that to the philosophy of how we want and who we want to partner with from a pharmacy standpoint. That's whether it's retail or specialty.
Very good. So looking straight at MedTrakRx, and if I did my research, which I did a little bit of before our call here, Tom, I was looking at some of the statistics. Looks like you guys are in the top 10, and some of that is based on a recent partnership. Can you go into what is MedTrakRx and who are the, if you will, the parent company, et cetera? How are things set up today?
Yeah, I'll skip back to kind of our inception. We've been in business. MedTrak started in '99, really by a couple individuals. One was a salesman at heart, a very dynamic individual, and the second was a pharmacist, and just were both very passionate as their experience had been previously in working with a PBM or on the payer side. They thought they could do it better. And so they started the company. And our niche, if you will, is the small to mid-sized commercial or self-insured type of client. And we work and have always had the philosophy of a high-touch, high-service model philosophy. The nice thing is currently, we still operate today with low overhead and low bureaucracy that you'll find with the larger organizations, and that just creates a tremendous amount of flexibility and nimbleness, if you will, to respond to our clients' needs. As I mentioned, I have been here about 3 years, and I came on board as a result of some changes that we were going through, and that change, as we still see in the market today, was some consolidations of PBMs, and we were actually acquired by a company up in Twinsburg, Ohio, called EnvisionRx. EnvisionRx is situated where they have a quite different business model or a PBM model than us. They do deal with commercial, but they also deal in the Medicaid, Medicare space. And their model is more of a more of a transparency model. So still two very different organizations. We've been able to work very well with them, have truly picked up some synergies on both sides. We had done some and continue to do things very differently, and I think on the leading edge, as well as they had some strengths around the contracting and some technology. Matter of fact, they own the Laker platform that we adjudicate the systems on, so there was a huge pickup there, just having a better access and being able to enhance that system. Shortly after that acquisition, Rite Aid went and acquired Envision, which was our parent company. And in general, that would always cause some, concern around what we've done and how we have to do it, because, obviously we know the position of CVS and most recently Walgreens. We were under the Walgreens light through their interest in acquiring Rite Aid, but we're very different, I still believe, in the CVS world. Our market share, we don't have the Rite Aid pharmacies in our market. Historically had them in there. They're on the West and East Coast, but they've been great to work with. They've really have left us alone, and they've provided some great guidance, and we're very stable and very happy to have that relationship with those two entities.
Yeah, and also, I mean, a word that would jump out for me with that is resources. I'm sure that those are abundant with the partnership within those, almost 3 different companies now. It looks like you guys have a diverse platform, if you will, to be able to look at things in a more collective scope, which I always think is good when you're able to scale out. And maybe a solution that you guys previously had at MedTrakRx, now you have some of these other partners might allow for you all to more effectively launch things. Does that take place?
That is correct. They've been great supporters. Both companies have been great supporters of MedTrak. It has given us truly in the acquisition side. Sometimes these acquisitions are good. Sometimes they're a challenge, as we've seen throughout history of not just in PBM but companies in general. But this one's truly been a beneficial one for MedTrak. It's allowed us to do some processes and implement processes a little bit quicker. From an expansion side, that's probably the biggest impact we've seen. We acquired 2 smaller PBMs on the East Coast about a year and a half ago, and that was a result of us being able to forge quicker in a process of expanding. And our goal was to get feet on the street, if you will, in the East Coast. Same way with it's afforded us to actually recently, our other ambition was to get folks on the West Coast. So we now have individuals in California and Arizona. So for the first time, we span coast to coast now, and I really think that was a result of the support that we've received from both organizations through these acquisitions.
Tom, when you and I connected a while back, we spent a lot of time discussing how important outcomes, right? True measurable outcomes are becoming in healthcare. And from my perspective, way overdue. I've often used the analogy of it's like playing a baseball game without even having a scoreboard sometimes in healthcare scenarios. Tell me a little bit more about MedTrakRx, a differentiator, right? So if I hear the acronym of PBM, my mind goes a lot of different directions. I'm sure some of our listeners also are either intimidated by the word PBM or don't really understand how it impacts their world directly. But if I look at the top 10 PBMs, for example, what has been MedTrakRx's differentiator?
I think one of the first things to look at, and it's not necessarily around our programs that are impactful, and I'll talk about those in a minute. But what I see from having the luxury, I guess, and the fortunate background of being able, from my Cardinal Health days and 1 or 2 other companies, but the biggest impact I see is our people. I've never seen a group of folks that are more dedicated around servicing the business, servicing our members, servicing our clients to the best of our abilities. I mentioned before we are very much a high touch, have a high touch philosophy. It starts in our clinical department down to our IT, sales and pharmacy benefit advisors, which we call, which are our customer service. And we really worked very diligently to service and provide a high level of care and consideration to those folks. I always like the statistics, and I think it demonstrates where we're at in our philosophy. Our customer service, first and foremost, they take around about 500 calls a day, and we have a first call resolution just under 90%, which is an astounding fact in its own right or number. Overall satisfaction rate is 97%, and then average answer to call, which I actually have that performance guarantee with our specialty pharmacies that we deal with, but they're 8 seconds. So we don't have a recording that you have to go through and say, press 1 for X department. You're going to get a live voice and somebody very quickly that's going to be able to resolve a question, issue, or an explanation of that benefit process. So very happy and proud to be a part of that group.
Well, so basically that's the exact opposite of my DirecTV experience last night.
Yeah. And I've experienced some specialty pharmacies where I've actually have made a call and one in particular earlier this year. It was a 2-hour ordeal. As a matter of fact, I got shipped over to an overseas telesales or call center, I should say, and a very unpleasant process. And it was just for me trying to resolve an issue that was for one of our members. And I just thought, this isn't a good experience. But, so our customer service and also our clinical department, which actually, I really believe, and I'm obviously biased, but I've also had the experience of working and meeting a lot of different pharmacists in my prior life. But I think we have some of the brightest and versatile and tightest knit group of clinical pharmacists and techs that I've ever worked with. They're very passionate. They go above and beyond the call of duty every day to make sure that when they're working with a patient and going through a prior authorization, that they're getting the right medication at the right time and making sure that service experience is where it needs to be, and they're providing the guidance. Again, I think it starts with the people, and I think that's our strength to start out with. The second piece, I think, goes along with a unique program we have, which is called the Best in Class Specialty RX program. And in that particular program, we got ahead of the curve, I believe, roughly in, I think it was 2009. We had the foresight to understand that specialty drugs were going to grow and be a focal point at some point in time in the future. And sure enough, that's, it's now a focal point. It's 30 to 35% of commercial client spend. These drugs, maintenance drugs, if you will, when you look at Humira and Emerald, they're $4,000 to $4,500 average, claim cost. It's a high growth area, and it continues to grow and evolve in that world. So luckily, the individuals before me had the foresight to understand and look at what can we do to make sure and ensure that we're prepared at some point in time, and work with our clients to make sure we're delivering the best possible care, best possible service at affordable rates and discounts that we can pass on to them. And that's the big, what we call the big specialty RX program.
Yeah, I like the Center of Excellence tone to that. We had a podcast with Tom Emmerich, who is the former head of global benefits design for Walmart, and one of his big pushes has been around kind of what you're talking around as far as Center of Excellence goes. In this circumstance, we're specifically focusing on specialty pharmacy, but throughout healthcare, there's opportunities, I think, to identify who some of those preeminent partners are that are accountable towards high performance. And I think in our earlier discussions, Tom, you and I, actually discussed the different types of metrics that are out there and how MedTrakRx goes about analyzing the data. Can you go a little bit into that data component? I think you guys have a very great feel for what the market needs on that front.
Yeah, that's an evolving process and segment for us. And I'll take a little bit of a step back. You kind of mentioned a previous podcast, and I had the opportunity to listen to one I think you did with Dr. Kyle Hogarth. And it was interesting, and it was good to hear his passion around his practice and his approach and thoughts towards some of the specialty pharmacies he deals with. And I wanted to stand up and clap when I heard some of his thoughts that he wants a specialty pharmacy to be more than a pick, pack, and shipper, if you will. That was my experience with Cardinal Health, is that we were a wholesaler. Our expertise was around picking a drug, packing it properly, and shipping it out to the retail pharmacy or hospital pharmacy. Going back to my earlier comments about where I grew up and working in a pharmacy, I want to make sure, and I agreed with Dr. Hogarth, the specialty pharmacy's got to be more than that. And around our best-in-class program, the specialty pharmacy network is part of that. It's really almost the start. We look at specialty pharmacies that can go, they have to, that should be a core requirement, right? That they've got to be able to pick that particular and fill that particular claim or that prescription, be able to pack it appropriately if it has any refrigeration requirements or shipping requirements, and be able to get it out the door on a timely basis so it's in the time of need. So that's step one. But even before they pick, pack, and ship, that pharmacy has to be prepared to assess a patient's needs, demonstrate that they can actually, that they're willing to work with them and provide the same level of care, same level of information, and address any potential ASEs that patient may have with that particular drug, and show that they have a high level of patient care. And that's what we seek out, in our best-in-class specialty pharmacy program. And the uniqueness of that program really starts with, I think my philosophy is, we look for the specialty within the specialty pharmacy provider. So we don't partner with one single pharmacy across the board. What we do is go through a pretty intensive, labor-heavy process every 2 years of going out to RFP, and we look for that pharmacy that is providing that high level of patient care, the operational excellence and reporting capabilities, and really the therapy class acuity per that therapy class. So, meaning that, we know the big 2 or 3 specialty pharmacies out there, they handle every therapy class under the sun. That doesn't make them the experts at every single one. We talked about, Christopher, you and I talked about what you guys do around hemophilia, and it is truly, that's the level of care we want to be able to provide to our patients, and that's the level of focus that we want. We want pharmacists talking to the patients, and I've ran across this to where some pharmacies hire pharmacy students that will answer calls and try and, navigate through some of the assessments. And that's not acceptable. That's not what our patients are expecting. From the reporting standpoint, it does start with the pharmacy, because you guys are the pharmacy is the front line. They're the ones that are collecting this data and having the conversations day in and day out with our members. And I think it's really important to be able to collect that data, and that's another requirement of our program, is to be able to collect and share that data so that we can then, continue to assess and continue to make sure the performance guarantee metrics are met, as well as work with, and I think this is as important as anything, is to work with and partner with the pharmacy to continue to improve those outcomes and measure those outcomes and be able to demonstrate, the value of what we do as a PBM to our clients. And it goes beyond just the pricing side, which I think we're very competitive, and we have some unique programs around driving, an additional 10 or 15% savings. But you got to start with the service piece, and that's a very, very high focus for us.
Very good. Well, we are going to take a quick break and get a message in from one of our sponsors. When we return, we'll pick up the conversation with Tom Golding from MedTrakRx. We'll be back in a second.
Keycentrix has been leading and guiding the pharmacy industry for over 40 years. A forerunner of innovation and technology, Keycentrix more than delivers pharmacy software solutions to the ever-expanding complex network of healthcare. The heart of Keycentrix is dedicated to restoring patient health and promoting patient compliance by the continuation of care through pharmacy management. Keycentrix brings pharmacy management to a comprehensive level of understanding and precision unlike anything available in the industry. Keycentrix new Leaf RX pharmacy management software revolutionizes this opportunity for specialty pharmacy markets. New Leaf RX thinks like a pharmacist and a prescriber at the same time, while also providing the data needed for decisions from every other contributor in the healthcare ecosystem. New Leaf RX will lead to successful outcome-based processes, guaranteed. At the end of the day, Keycentrix software packages have what every pharmacy has been looking for. New Leaf RX is the next level of pharmacy management systems. For more information and to experience a demo, visit keycentrix.com.
All right, we're back on. This is Christopher Kennedy with the Specialty Pharmacy Podcast Show. And with me again is Tom Golding from MedTrakRx. Tom shared a lot of great insights there into the kind of the differentiators at MedTrakRx and the overall marketplace is where I'd like to kind of shift focus. In that PBM specific market, where do you see things heading in the next years? Next few years. I know that when we talk from the lens of a specialty pharmacy provider like myself and others that are, I'm sure, listening to our podcast here, we think in terms of the outcomes race and how do we become more savvy at having a hand in how the actual patient journey goes. From a PBM perspective, where do you think things will be headed?
That's a great question, and one that, until recently, probably has been rethought or put in a different position, especially with Amazon coming into the conversation. But, you and I had previously talked about, and you brought up really what I would call performance-based contracting or performance-based outcomes that can evolve around contracting. That's been around for some time. I saw it in my med-surg days, and it was, a little bit easier monitored about, how a company was performing really. In our space in the PBM world, I know that there's some PBMs and organizations that have some contracts in place around that. I'm not sure of the value. A lot of data, I think some of that is still new. My concern around that is really having the accessibility and transparency, if you will, back to the actual patient data that resides on, the health system or entities, clinical system, and being able to share and then be able to monitor that. And, I think there's a huge expense tied to that. So I think that's going to continue to evolve and continue to make some challenge or meet some challenges, but also meet some efficiencies there. And what we're doing to address that is really looking at a higher level and addressing adherence issues, making sure that, which is big from a standpoint of looking at specific therapy classes. I think also looking at better predictive analytics. That's one thing that I think will move forward, especially with our market segment where we're dealing with the smaller commercial clients. They're really starting to get concerned about not just what they're spending on, focus on specialty drugs, but obviously the retail side as well, where diabetes is so prevalent and a huge expense, but where they can start better understanding what they need to do the next year and the following year. You have high costing drugs and you have new drugs that are in the market that are, $30,000, $40,000, $50,000 per therapy. And it can really impact a smaller company very quickly. So I think predictive analytics are going to start to evolve a little bit quicker. And the buzzword, I think, is really addressing retail consumerism. Trying to provide some transparency around where, from a retail standpoint, when you're looking at retail pharmacies, there's just a big cloud around that. It's like nobody really knows. If you talk to the average person that's processed, that's having a retail prescription process, generally speaking, they have no idea what that prescription actually costs. And it does not allow them, the current matrix around the process doesn't allow them really to shop. Amazon to a degree may actually resolve some of that, but we'll see, we'll know, I guess, before Thanksgiving to which direction they're going. So, but I think that's going to be one of the bigger drivers is kind of that retail consumerism and treating things a little bit more transparent and understanding where you really should have a claim processed and where you get the best value in the service.
Yeah, it's a great point. I think that in this patient as a consumer movement, one of the things that continues to be highlighted is even things like accreditation, for example. There's multiple accrediting bodies that are available in the specialty pharmacy world, URAC, ACHC, et cetera. And I think as patients start to realize the power of their healthcare dollar, that people will become more and more savvy, as you mentioned, Amazon, and maybe even start demanding some sort of star report, right? Like I want to know a star ranking before I choose a particular pharmacy for maybe a specialized disease that I have. I want to find out who that best provider is. So I think Amazon brings a lot into the discussion. I joke about being able to, read, I think it was a crazy number, like 897 reviews on a lawn chair that I bought for my son's baseball game to take around with me this past summer, all these baseball games. And I learned 800 different views on this product. Yet when I go to either my physician or to a pharmacy to fill a prescription for my son, I have no clue, right? I don't have any of that data and until I start to ask questions and do that homework and Google around, if you will. So it'll be interesting to see if technology and some of these more established platforms like Amazon can progress us on a few different fronts. And I think the key word for me continues to be in my 18-year career in healthcare is accountability. I think this industry, for whatever reason, has found ways to avoid some of that high performance accountability. So I, from my standpoint, am a fan of seeing some of these efforts move in that direction. And then after speaking with you and listening to you here today, it's clear that MedTrakRx, you guys are focused on that collaborative care. You didn't voice that exact term, but for me, there's a lot of collaboration that can occur between partners that join around a patient on their journey and really do, and this isn't marketing speak, right, but really have a hand in how that patient's journey goes. Anything on that, Tom, that you guys are doing regarding the patient experience and trying to be more in concert with your partners?
Yeah, and I'll comment because you're exactly right. The star rating, the URAC accreditation, those are very important. And in a way, although we're not to the level of what you've talked about, and that's a great example about the reviews on your lawn chair or a computer or whatever it may be, and then it comes to something really important about healthcare. We, in a sense, do that with our big specialty pharmacies. We go through a pretty rigorous criteria process, and I vetted the last RFP, well over 30 pharmacies. And the first, the two primary criteria is one is are you a URAC or similar accredited? And all of our pharmacies are URAC accredited. We've got, or they must be going through the process, and are they licensed in 50 states? And obviously that eliminates about half of them. And then we take it a step further. Is we constantly do surveys. We send out surveys every quarter and rank the customer experience on each of our specialty pharmacy. And that does impact, we will make changes, and we do have accountability, or they do have accountability. If they're not servicing the customer to the level that we're expecting and that they had agreed on to begin with, then through the RFP process, we will make those changes. So that's a big piece. As far as addressing, different things that I think we do that really impact, and again, I'm very passionate about our ability to impact and lower the cost of drugs the best we can, especially dealing with the clients we have. We actually have two clients from my hometown that are under our watch. And I know these folks personally, grew up with them, and I have a vested interest in them, and it rolls over to everybody else. So one of the programs and one of the watches that we've had was around the copay plans. You know, we have worked feverishly for the last 3 years ahead of anybody else, really looking at understanding what the copay assistance and how that can be and how that affects somebody's plan. There's a lot of old plan designs out there that are still stuck in a flat $35 or $50 level. And what we've been able to do is at least be able to go back to the client, and since we've got a pretty firm understanding what assistance programs are out there, help them look at options and guide them to different plan designs that really will benefit not only them from reducing their costs, but also reduce the cost to the client, or I'm sorry, to the member, because the copays are virtually $0 or $5 or $10 for a lot of these drugs. But through some of that, we've been able to demonstrate a 10-15% savings off their specialty spend. And it's really impactful. And that's been some of the pieces that we've worked really hard on, along with just our clinical care program. So, we continually work to develop and come up with new plans and monitor, back to the data. Data's powerful. If we can understand, the drivers that are affecting these type of clients and groups, then the better we're positioned to give them guidance and hopefully help them drive their overall drug spend down.
Well, it's been very impressive and well said, Tom, on this last point, Tom. But I'll tell you, it's been very impressive to hear kind of the collective nature of what you all are doing there. I think there's definitely that center of excellence feel to how you all are approaching not only the business, but it sounds like that patient experience itself. And ultimately, as you stated earlier in the conversation, when you were raised in a small town pharmacy like that, it becomes second nature to treat your customers in a certain way. And it's clear that that's transcending throughout what you're doing today. So I commend you on that. I also want to thank all of our listeners for joining us. I'm sure there were at least a few nuggets of knowledge that you will take with you from this podcast. And I invite you to continue to send your feedback and comments. If there's a topic or a discussion point you'd like us to feature on the next Specialty Pharmacy Podcast show, please let me know. Until the next time, I'm signing off here. Thank you for joining us, and we will talk to you again soon.
Thanks for listening to the Specialty Pharmacy Podcast. Be sure to share this podcast with your fellow pharmacists, doctors, and healthcare providers dedicated to optimal patient care. If you have ideas for future episode topics, please email the Pharmacy Podcast Network. Send your message to publisher@pharmacypodcast.com.